name's Megan. I'm a paramedic with Morristown-Hamblen EMS. I'm here to show you the PediMate child securing device for our stretchers. This is good for a 10 to 40 pound patient. It's mostly for medical. Trauma patients should remain in their car seat unless it's obviously damaged, and then we can take them out and use this for them. So how it works, it's 2 straps to keep it secured. You will find this on the back compartment passenger side with the seat collars and CIDs. So you unroll it and it has all the straps. Alrighty, it comes up here towards the head of the stretcher, and then you have black straps which secure to the stretcher, and then gray straps which will secure to your patient. So you'll come back here with the head of the bed, 2 straps, come back here, secure it, and you'll tighten it down. And then these go to the frame of the stretcher. They do not go here on the rails. So you'll come down, bring it through and feed it back up, secure it, and then tighten it if you need to. It's easier to tighten it with the rail up. Same thing on this side. Strap through the rail, back up, and tighten it. And it is pretty secure already. So we have a mannequin to show you. So you'll put your patient here, head at the top, of course. You'll put their arms through the straps, and then this strap goes through just like that. So it just feeds through the 4 sides, and then you have the 2 clips. This part needs to come up with the belt. You'll secure it right there. You can take your extra strap or extra length there, and then you can tighten it on either side to make sure that the patient is secure. Pulling it down, and then this needs to be up here at the sternum so it's secure. Once you're done with it, it needs to be wiped down, re-rolled, and put back in the correct compartment.